Our poster addresses an important need in men with early stage prostate cancer. We've recognized over the last decade or so that many men diagnosed with early stage disease, in fact, have indolent cancers that don't need to be treated. And so working with several companies, Genomic Health is one of them, we help develop some biopsy-based genomic tests that can tell how aggressive a specific tumor is and whether or not someone would benefit from treatment or how frequently they need to be followed. Those tests are primarily used in men with NCCN very low and low risk disease, but there's a growing sentiment that even men with intermediate risk disease and maybe the occasional patient with high risk disease actually has biologically indolent tumor. And the high risk is defined, or intermediate and high risk is generally defined by histology and PSA. But we're learning that the genomics can reveal the underlying genomic instability in each tumor and help us make an informed decision about what's best for each individual patient. It's really the precision medicine approach applied to early stage disease. And so the poster that I'm presenting today focuses on a subgroup of men that we haven't looked at before really in much detail, and that's with men who have intermediate or high risk disease by NCCN criteria. And what we can show is that we can stratify good and bad outcomes in men who have similar histology or similar grade tumor or similar risk categorization based on clinical tumors when you add the genomics in. There are lots of challenges in using these tests. One challenge is the genomic literacy of physicians and patients in the broad, in the broad landscape of the world, which isn't very high actually. So one big challenge is to educate people on what these are and how they add things and how they improve or inform decision making. Another issue is reimbursement. So there are many genomic tests that are well established now for breast cancer and some other tumors. In prostate cancer in the United States, Medicare will cover use of these tests for men with very low or low risk disease, but we have not yet convinced them to cover intermediate risk disease, and that's going to be a challenge also.